Hello, Julia. So Julia is
Hi.
our guest. We honored to have Julia on our podcast. We as judokas and as athletes, we are very much interested in how to optimize our performance and how to be healthy and how to improve ourselves. And Julia is here to help us learn how to breathe. And there's there's a lot of I'm very curious about this because I think as humans we're like if somebody told us, oh, there's this exotic fruit that you can eat and just going to make you healthy and it's going to make you live longer, we'll be like so interested. But we tend to ignore stuff that are like right next to us. And breathing is one of those things. And so I'm super excited to have Julia here. She is the founder of Mayo.
Happy
Breathe.
Mayo.
Happy Mayo. Okay, why don't you just introduce yourself? Go ahead.
Okay. Well, thank you so much for a wonderful introduction, and thank you for having me on your podcast. And I'm very excited to share all my knowledge, whatever I have to offer to your judogas. And I'm very excited. Yes, so I'm a founder of Manhattan-based holistic practice. It's called Happy Mayo. Mayo is a muscle. Happy is a happy muscle because I work with a lot of muscles, including the breathing muscle, which is the diaphragm, and all the muscles of the chest. And so I'm also a dental hygienist. I'm a certified Buteyko breathing re-educator, and my journey to holistic practice started years ago when I noticed that a lot of my patients were complaining about sleep quality. They were falling asleep in a chair. As soon as I put the chair back to have the dental cleaning, they're like falling asleep and snoring. So that led me to kind of dig a little bit more into the problems of sleep at first, and that's how I became a sleep coach first. And then while diving more and more, it's like a rabbit hole, like you just start digging and digging. And then I found the sleep apnea and the traits of dysfunctional breathing and the effect of our breathing on our regular life. The breathing.
Julia, that's good. So yes, I was going to ask you, so sometimes like at work, I probably shouldn't admit this on the podcast that's going to go on YouTube, but I have no trouble falling asleep at work in a meeting. And but then at night, sometimes my quality, like I wake up frequently. Is this related? Because you mentioned patients falling asleep in a chair, and then there's a sleep quality problem.
Yes, it's actually it might be a sign of sleep apnea. Have you ever had it checked?
No, I haven't. I don't go to doctors.
Yeah, so the sleep, like the excessive sleepiness during the day is one of the sign of sleep disorder breathing and often enough related to a sleep apnea. So I would probably recommend you to have it
What,
checked with the
real
doctor.
quick. So what is sleep apnea?
Sleep apnea is when you actually cannot breathe at night for a couple of seconds. And then when you wake up, you wake up and you gasping for air. So that's when the cessation of breathing for a couple of seconds.
Yeah, I don't think I have sleep apnea because I'm not gasping for air. I don't have any problem. Haven't noticed any of that. I think I would have noticed. It's just that, when I was young, I could just sleep like no, it wasn't even a problem. I wasn't thinking about it. As I got a little older, it's like, well, sometimes I'll wake up and I can't fall back asleep. And I noticed I don't need as much sleep either. But then falling asleep like at work or in school, that's been always a problem for me.
So this is a little of a misconception that as we age, we don't need as much sleep. We probably don't need as much, but we still need to sleep. And the reason why you cannot fall asleep at night because probably when you breathe a little bit too fast. What we want to do, like with the Buteyko breathing re-education, so I usually recommend to engage your diaphragm more into the breathing. It's all about slow, more controlled, not very deep, not with the chest, mostly with the belly breathing. Okay, and I usually recommend like to have like a meditation before you go to bed, and that helps to relax your nervous system. So, and we were talking about that, like before, and it's a parasympathetic and sympathetic response, how important it is in our bodily function in general,
Hmm.
for our health.
Okay. Okay, great. So sorry to interrupt you. Continue
No, no, no,
with
no.
what
That's
you was
absolutely my pleasure.
Mm-hmm. So how maybe how did you? So you mentioned most of our listeners, I guess, you mentioned this name Buteyko, and
Hmm.
I know a little bit about this Russian professor, Soviet professor that started this breathing. So discovered some new things about breathing. Can you talk more about him?
Sure, absolutely. So the Buteyko, he was struggling with his own health. So, and as a doctor, he also noticed, and he had a lot of patients who were sick and they were breathing really heavily. So he was thinking, is that the sickness brings such a heavy breathing, or the heavy breathing brings the sickness? So he started kind of working with the different breathing techniques. So his core principles are on slow breathing. I call it LSD, and that's very easy to remember. So it's a breathing light, breathing slow, and breathing deep. The difference between the deep breathing and the big breathing is huge, because often enough you hear like you have to take a big breath. It's like it's not the right way of breathing, because when you have to breathe, you have to breathe low, deep, and wider, instead of being big breath from the chest, because then that you don't have the oxygenation from the lower parts of your lungs. You don't get an oxygenation, and gas exchange. So the Buteyko was trying to develop a system for asthma sufferers first. Okay, so that's it was involving the control of breathing, the depth, how much air they're taking to prevent the hyperventilation. He also emphasizes the breathing through the nose, because it's very important. The nose breathing minimizes the amount of air you're breathing. So the difference between the orifices in nose and in your mouth is huge. If you breathe through the mouth, you take a lot of air in, a lot of air out. Through the nose, it's more controlled. So that's what breathing education is all about. More controlled breathing, to have your own control of the breathing, and being able to manipulate the breathing at a different situation, in an anxiety, during stress, not being able to fall asleep. Well, count down to also use
Mhm.
that.
Okay, so I'm still a little bit I'm trying to figure this out for myself.
Sure.
I'm not sure if I figured it out 100%, but I'm sure a lot of people who would be listening, they might be completely confused about it, because you just said you have to breathe deep, right?
But
You
not
use the
wide,
word
not
deep.
big.
Well, let me ask first, and then you can unconfuse me. So you
Sure.
said breathe light and breathe deep, which sound a little bit like what am I actually supposed to do? Like light and deep sounds like a little confusing. Also, you said usually, also traditionally, culturally, we think more air is better, right? And you just said, well, breathing through the nose decreases the amount of air. So, but at the same time, you said breathe deep. So now it's like confusion in my brain. Well, what is it? Is a lot of air good? Is a lot of air bad? How do I deal with this?
Okay. I just recently found an interesting, I don't remember if I was listening to that or I was reading something. They said then the big breath, through, and they exhale through the mouth, was the movement in 1880, I think, in Europe, because at this time they had a lot of issues that it's called the hygienic breath. So they were taking a lot of air in and exhale a lot through the mouth. That was a movement. This movement unfortunately moved to India, where the yoga was originated. So, and then it came back to Europe. So the breathing originally, if we're going to go back to like a healthy and healthy breathing, is always was through the nose. Okay. So again, when I say breathing light, meaning you control how much air you taking in. So you taking a little bit air through the nose and air out. So it's more controlled. That's a light breathing. We also want to slow down the breathing a little bit. So our goal is to have 4.5 to 6.5 breaths per minute. So now we see that a lot of people are breathing like 12 times a minute, sometimes 18, and that's already a sign of hyperventilation.
Mhm.
Okay, so when I say breathing deep, I mean don't breathe through your chest, breathe through your diaphragm. Diaphragm is all the way down there. So when you breathe slow and low, it goes all the way down, and it helps with the changing of the gas. Okay, but
Mhm.
when you take a big air, either through the nose, even the fast, like imagine a little a straw. So if you have a straw and it's like a lot of air and water coming in, it's like it's going to collapse at some point, like, so we need to make sure that everything is more controlled.
Mhm.
Did
Well,
I
for
confuse you, did I confuse you more?
Carmen, you have something to say? Go ahead.
when I run, it hurts
On the side.
on the side.
When
That
you run.
this, yeah, it's. I think Carmen. I think this is a different problem. Maybe we'll
No,
touch on
but
this later.
when I
Maybe Julia can answer that. A lot of people have that when you start running, and
Mm-hmm.
traditionally they say, well, maybe it's just like after eating.
Mm-hmm.
But with her, it happens. I'm not really sure why, because she exercises a lot. She is a good athlete, but sometimes when you just walk, she starts feeling a pain, like
Sharp.
somewhere in the abdomen, which
Mm-hmm.
is like a common thing. Like for me, it used to be like always on one side, but I think
Mm-hmm.
it's a little bit different for different people. And sometimes when you breathe,
because
it goes away
sometimes is
in the middle.
in the middle, or sometimes is in
Okay.
the
So let me ask you this question. When you run, do you open your mouth? Do you breathe with through your mouth when you run? Like
sometimes.
sometimes. All right. So I would recommend you to try to breathe through your nose all the time if you can.
But well, when I breathe through my nose, sometimes it still happens.
It does. Interesting, because I just started running 5Ks and I only run with a closed nose, and I'm not very athletic. I admit that. I'm an amateur 5K runner, but when I run, I only breathe through the nose, and I never have a problem with my pain, with anything. Because when we breathe through the nose, we're also producing nitric oxide. Nitric oxide is very important gas. What it does is it relaxes the smooth muscle first, and in addition to that, it opening up a little bit of the vessels, then we get a little bit better flow of the blood through the. It also slows down the blood pressure, and it's like it increases oxygenation also, so
Okay,
that
can
helps
you explain this a little bit? So how do we why it
produce
is how do we produce nitric oxide?
nitric
Uh,
oxide. Yes, nitric oxide we produce in our body. Okay, so there's like, as you said before, like we also want to eat something and feel better, right? So the nitric oxide is something we produce, and we produce it by breathing through the nose. We have different parts in our body where we produce nitric oxide, but the nose is the one of the main location where
Sure.
it happens. It happens in our nasal cavities. Okay, so every time when you breathe in and breathe out, you're producing nitric oxide. And this nitric oxide goes to the lungs, helping with oxygenation, helping the smooth muscle, relaxes the smooth muscles, and also reduces the blood pressure, because the vessels become a little bit more, it's a vasodilator, so it opens the vessels and the blood flows much freely, and
This
that's what
is
helps. Yeah.
Yeah, this is super cool. This is me, and maybe it's very hard for people to accept this because I I personally I have not heard of this before. I heard of this recently, but it probably takes time for you to get used to it because everybody is around you. Never people never say this stuff. They say, well, oxygen, like oxygen is supposed to be good for you, but then there's other completely other thing which is not even related, not even to carbon dioxide, not even to oxygen. It's nitric oxide, and all of a sudden it has all these good effects on the body, and it gets produced when you breathe through the nose
Yes.
somehow. This is
And I
this is
have, yeah, yeah, absolutely. And I have a couple of exercises that I always implement into my training. Um, humming. Humming is the best exercise for helping with a lot of things. And I'll show you how to use that. You can use it with anybody. Usually I recommend to start to do it in the shower, because the moist air like kind of moisturizes the nasal cavities as well a little bit. So the humming is very easy. It's annoying
okay.
sometimes, but it's very easy. You take an air in through your nose, and then you exhale and you hum. Mm, It sounds like a monk, maybe like monks, like
You know what
humming.
it sounds like? It sounds like a bumblebee,
Oh,
I think.
bumblebee, that's great. That's
Carmen,
really
Carmen,
good.
you want to try bumblebee? Let's do it together.
Very good. So make sure that when you take the air, you take the air only through the nose.
О, see, давай так, через нос. Let's go through the
So
nose.
very good. I would recommend to start doing that in the shower. That's very helpful. It's also they have like a couple of foods that you can eat. You can eat anything like with this sort of sulfuric kind of content is like onions and garlics. You can eat that and go to the sun for a couple of minutes. Then also going to help you to produce more nitric oxide. So you will
Okay,
see
so
that.
question, so practical question.
Yeah,
How long, how often should I do this?
the humming.
Uh, will I be able to notice the effects right away? Any practical suggestions?
So um, start humming in the shower first. Okay, that's really good. So you can start practicing humming before you go to bed. Also, and I would say maybe up to 6 minutes a day. You can do the humming anytime when you're doing something mundane, like folding laundry, doing dishes, or anything like that. You can hum along. So, or you hear a nice, song that you like, you can certainly hum along with that. Yeah, so the nitric oxide is very important gas in our body, in addition to carbon dioxide for our
So
breathing.
one more time, let's recap real quick. So what does nitric oxide do?
Nitric oxide. Yes, it's not nitrous like
Oh,
it's
sorry,
like
nitric. Sorry,
yes.
Professor.
So what it does again? So it's a vasodilator. So it enlarges the the capillaries and the veins and everything that's like has blood in it. So it relaxes it, and the blood flows is like not constricted. It slows down the blood pressure, relaxes the smooth muscle, and when you exercise with the closed mouth and breathing through the nose, it's actually preventing you to develop too much of the lactic acid in your muscles, so you don't have pain when you exercise.
Okay, great. Okay, let's move on to the other subject. That's very important. There's so many questions I want to ask you. One thing, the purpose, I think the main purpose of Buteyko's method was to treat asthma.
Yes.
And I actually have a couple of kids that I know that practice judo
Yeah.
with asthma, and I would like to help them. So can you go dive into that a little bit?
Kids with asthma. It's an interesting question because asthma is a complementary to their asthma medications treatment. So with time, with the practice, it requires a lot of exercises, supervision by a professional and by parents also. It's not enough for the child just to start doing breath holds exercises and then he miraculously, recovered from asthma. So with the exercises regularly, I would say sometimes for the asthma sufferers, it's like up to 15 to 16 times a day they have to practice with different kind of breathing exercises. Okay, it's also always will be a nose breathing. It's always will be the controlled breathing, to prevent from hyperventilation. It's always will be a nose breathing because it's also warms up the air, and when the child breathes through the nose, so he controls the air a little bit more, and the air is more filtered, so it doesn't
Hmm.
have all the particles and can actually trigger the asthma. So I don't know if you can't really per se to help this child, but what you can make sure, then the child breathes through the nose. The difficulty with the children, first we have to make sure that the child can breathe through the nose. If child cannot breathe through the nose, there's many reasons. One of the reasons is a physical obstruction. If the child has adenoids in it, he won't be able to breathe through the nose. So the physical obstruction needs to be addressed by ENT, by any kind of doctor who deal with this kind of issues. The problem there also, if the child had the physical obstruction for a very long time, the mouth breathing becoming a habit.
Hmm.
So it's sometimes it's not enough just to remove the physical obstruction. If the behavior changes were not addressed, the child will continue breathe through the mouth because it's easier. But the
Well,
mouth will be.
I'll be honest with you. Even for me, I've heard this about breathing through the nose a long time ago. But a lot of times you just have mucus. Half the time we're sick, and so it's just not practical. For me, maybe I can inhale through the nose, exhale through the mouth. That's a little bit more practical because otherwise, there's social problems
Oh,
associated
that's
with
a
it.
wonderful question. I really love the way you think, and it's amazing. I'm very impressed how well aware you're of your body. That tells that you're like very intuitive about that, and it's fantastic. The
When
only thing
mucus comes out of my nose, people tend to let me know. They
so I
make me
want
aware.
yeah, they actually the paradox here. The more you use your nose, the less clogged it's gonna be. So that's how it is. So you use
Okay.
it or you lose it. You have to use your nose in order to have a proper nasal patencies. So before you start practicing any kind of Buteyko breathing, so you have to make sure that you can breathe through the nose, in and out. So how do we do that? I want to make sure that a child or an adult can breathe through the mouth for at least 1 minute. The rule of thumb is if you can breathe through the nose in and out for 1 minute, with no problems, like without gasping for air or stopping and breathe through the mouth, you're good for life. You can always breathe through your nose. Okay, and this, as I was saying, it's a behavioral issues too. Why would you exhale through the mouth when your nostrils are so small? So the amount of air you took in, the oxygen, and the amount of the carbon dioxide that you exhale, it's not like in a balance. So our goal is to have more equilibrium with the gas exchange, because without carbon dioxide, you won't be able to exchange oxygen. Carbon dioxide is a pivotal aspect in like removing the oxygen from hemoglobin. So
Hmm.
without carbon dioxide that you exhale through the mouth, you won't be able to have a proper oxygenation. No matter how much air you're going to be taking, you're going to be triggering the sympathetic response instead of proper oxygenation.
Okay, so I wanna dive more into the carbon dioxide thing because I think this is what interests me the most in this for some reason. But let's stay with the asthma for a second. When I searched up Buteyko a while ago, I saw him doing some exercises with the kids or adults, and I guess it all comes down to kind of exhaling and trying to hold the breath on exhale. This is
That's
what
right.
I saw. Is that so? Am I confused there, or can you go more
No,
into
you're
that?
not confused. You're absolutely right. The Buteyko recommends to hold the breath on the exhale. And why? Because we want to harvest carbon dioxide. So it's all about carbon dioxide here, so because when we inhale and exhale, you close your nose and you basically keeping the carbon dioxide inside of your body. We want to prevent the outburst of like taking too much air, because we want to prevent the chemosensitivity to carbon dioxide. Often enough, people, especially nowadays, because we are always like on a rush, we have like all the kind of anxiety, we're constantly running somewhere, so that tells us that we don't have enough carbon dioxide in our system, and we are extremely sensitive to carbon dioxide. We constantly want to take more air, and we want to take air through the mouth and through to our chest.
Hmm.
That will increase the also asthma attacks in kids too, especially if they run with open mouth. So that definitely will not help them to control their breathing. Yeah.
So before we go into the carbon dioxide, I just want to get a couple of practical suggestions for people who are dealing with asthma. I mean, of course, they should see the doctor and they should possibly take the medication. Uh, Although, I would personally, like, I'm not recommending this. I'm not a doctor. I'm always a little bit. I mean, medication. In my opinion, medications should be taken to relieve of the symptoms. Most of the medications, most of the doctors nowadays, they could be good at relieving the symptoms, and there's nothing wrong with that, but they're not treating the root cause. So for example, so maybe you have asthma, you inhale, that relieves the symptoms right away, or maybe you take some drugs that will just take away the symptoms. But what I like about some of the sort of natural, I really hate using the word natural because it's going to turn off some of the people right away, because just because something is natural, it doesn't mean it's good. But some of those holistic methods. So basically what I like is just thinking that the actual treatment of the cause, of the root cause of the disease, is a lot of times much it's not with the drugs. The drugs treat the symptoms, but the root cause
Basically, the
is your
bronchodilator.
lifestyle, is being aware of all the tools that are at your disposal. So let's talk a little bit about can some kind of breathing exercises like Buteyko breathing, how can they help somebody with asthma, and what specifically they should try to do in addition to seeing their doctor and in addition to taking the medicine to help them with the symptoms?
Very good question. A lot. They can do a lot. I usually, start with my patient. I try to remove the foods from their diet that are inflammatory and causes inflammatory response. It's the sugar, gluten, grains, and the dairy. The reason I include dairy in that because dairy is a mucus forming element. So that's why, I recommend to at least to be off those groups of food for a week, okay, and see if any changes happen. If we see then it's helping with the mucus production or lack of mucus in the nose, which allows to breathe through the nose a little bit better. So we're gonna stay on off this group of foods for longer. We have to know what's the allergy this child has. If it's an environmental allergies of any kind. If if they've seen an allergist, if the allergist recommended to have, I don't know, to avoid pollen or dust. Kids with asthma often have pets at home, and the pet dandruff often enough triggering the asthma attacks as well. So to remove all the elements that causes them to have an attack. So yeah, so those are little things to start with. And again, cannot stress it enough. Nose breathing, everything. It filters the air, it humidifies the air, warms the air. So those are three already triggering factors for asthma attacks. So with those little ones, okay? So, and again, not mouth breathe, always nose breathe. The best exercise though for asthma sufferers is the swimming. And you know why? Because when they swim, the lungs and the diaphragm is kind of floating there. So it's easier for them to breathe as well.
Let me ask you something right there. I think so. I heard this before also, but then most of the time when you swim, especially in the winter, it's going to be a closed pool with chlorine. Isn't chlorine bad for asthma?
It is bad. It can be bad, but if you have to choose the exercise, tell me if it's in any kind of sport environment, any closed environment, you will have something that can trigger that. Yeah. So that's I wouldn't say that it's the best exercise for asthma sufferers, but at least that's I'm saying then from physical perspective, not from chemical perspective.
So you believe that the pros of swimming outweigh the cons of breathing in some of that chlorine.
Again, we have to make sure that the child doesn't have any allergy to that if he's capable of swimming and being in a swimming pool.
Okay.
Yeah. So, but I personally do like breathing and breath hold exercises for asthma sufferers. They have this little small breath holds. They're very, very short in duration, but they're also very effective. So while we're teaching a child how to control the asthma attacks, the more control they have of their life and of their breathing, so the better their life quality is going to be. Also, they are not constantly relating on their puffers.
Okay, so would you be able to recommend right now how to hold, if somebody wants to try to do it, how should they go about it, holding their breath? I think we already discussed it, and you mentioned that it's better to do
Yeah,
it on the
I
exhale.
certainly can. I just want to make sure then I want everybody to know then it's not a medical solution, and it always has to be supervised.
Of
Okay, so I
course.
don't know like how your listeners or viewers are going to be using that. So again, before doing any exercises of the Buteyko breathing, we have to make sure that the child can breathe through the nose.
Hmm.
That's the first thing. And I usually start with the kids, like just by doing any kind of exercise with closed lips. I'm not taping the lips, I'm not doing anything. I just want to make sure that the child, when he's doing any kind of exercise, walking, um, running, always lips closed. Okay,
Hmm.
that's the first exercise. They do have exercise. You breathe you breathe through your nose on the count of two, and exhale on the count of two, and then you can hold your breath for a count of two. So you can try to do that also. Okay, but again, this is not for anybody to start doing that for the child if they don't know what they're doing. Okay, it
Okay.
has to be supervised. I just have to like specifically say that I don't want anybody to start. Oh, let's do the breathing exercises. With adults, is a little bit differently because
Yeah.
adults have a little better control of their body, the more understanding of their body. Okay, kids are just you tell them hold the breath, they're gonna hold the breath, and
Hmm.
they don't know how long to hold the breath. Sometimes they need a little bit more specific um, instructions how to use it. And I usually, when I work with kids, I always introduce a lot of games.
Hmm.
So this is very important for kids too.
Hmm.
When they exercise, I want to make sure that they close it. We
Can you give an
create.
example? Can you give an example of any of the games?
Yeah, sure. You can make like at your gym, you can make like an obstacle course. They have a time, let's say 2 minutes time, right? So they're running from one point to another, and they absolutely must breathe through the nose. And when they have to breathe through the mouth, they have to stop, and then you stop the time. So each time they're actually basically fighting their own time. So they try to
Hmm.
beat their own time. So they're competing against not against each other, against themselves. So the first time they did an obstacle course in 2 minutes, the next time they can do it in 1 minute without stopping. Because every time when you stop, they stop, you stop your timer as well, your
Hmm.
stopwatch. Yeah. So the obstacle course are very important reading. So when you read to a child a book, and then when you see then the child start breathing through the mouth, you stop reading. When you stop
Hmm.
reading, the child will say, hey, why did you stop reading? I'm like, well, because your mouth was open. You don't say close your mouth, you just say your mouth was open. So you continue reading, and every time when child opens the mouth, you start reading again.
Hmm.
You start breathing, and the child already will know that's going to be a sign for it. So they know then they have to keep the mouth closed. So
Hmm.
those are behavioral alternation of the like how to introduce the nasal breathing for kids with asthma, and any other
Okay.
kids with the asthma. That's basically the main concern.
Okay, great. So now let's move on to the athletes, right?
Yes,
Assuming we don't have asthma, and our goal is just to improve, like supercharge our athletic performance. Okay,
excellent.
we're trying to get more endurance. We got, judo is a very special sport. I don't know if you're familiar with it.
I
It's
am.
um, it's a lot of you get tired very fast, and if you're supposed to be relaxed, and it's all good. If you're fighting somebody who is not at your level, you can almost not get tired because you will not use your muscles as much as the other person. But if you're fighting somebody on your level, it's basically the person who has more endurance that's going to win. Who is capable of using the muscles explosively for longer, do that for longer. So I'm looking into There's this institution called Oxygen Advantage. I think you're probably
Yes.
familiar with it.
Yes, yes,
It's
yes, yes.
popular, and I
That's a
think
professor that I took the classes with, so I have like all of his books, and I'm listening to him all the time. So actually, I was listening to him
yeah,
last week.
great. So I think they've done a lot of research about athletes, like holding breath uh, during exercise, during explosive exercises, and just this whole research about carbon dioxide and how usually we think of it as the bad guy, but it
Mm-hmm.
turns out that there's a lot of benefit in trying to accumulate carbon dioxide in your body. So can you go into those things a little bit?
Sure, sure. So it's not that we want to have too much of carbon dioxide. Carbon dioxide is a gas that actually stimulates the breathing. So if it's too much of carbon dioxide, you will be hyperventilating because you need more air. So we need to have a balanced carbon dioxide. And that's again, I'm like beating the dead horse now. So breathing through the nose then will allow you to balance how much air you're taking in and how much air you're taking out. Okay, so for athletes during the performance, I honestly don't know how to hold the breath and excuse me, and fight anybody. But what I can recommend, so definitely a warm up, not only for the physical, like for your muscles warm up, warming up your airways. That's very important because when you breathe through the nose and you doing a breath hold exercises before your physical warm up, that will help you also. So those three gases then we need: oxygen, nitric oxide, and the carbon dioxide. Those are three gases that are actually helping you to have a better performance. Oxygen for oxygenation of the blood, and carbon dioxide for a better exchange, and the nitric oxide to relax the smooth muscle so the muscle does not produce its lactic acid, so you're not getting tired too quickly.
Hmm.
So what you probably can do for your athletes, I don't know, like again, specific of the judo, I do know how it looks. I never practiced that, obviously,
Hmm.
but what you can do, you can introduce a lot of breathing exercises. So I definitely relax breathing. That's very important. The relaxed breathing is always when you're engaging the diaphragmatic breathing. You can have like a little bit of guided meditation on the breathing just before your athletes start training, and reduce breathing. Reduced breathing is when we are taking as much air as we just need, not too much, not too little, but it has to be reduced breathing. I have like a feather exercises that I'm using. So when you kind of holding the finger next to your nose and you kind of take like maybe an inch air in and inch air out and no more. So you have to feel like you have enough air, but you do want to have more, but you're
Hmm.
okay not to take it. So this is also that's the reduced breathing exercises that will helps you to control the carbon dioxide better. That will help you to engage diaphragm to breathe more and to have a better proper gas exchange from the dead zones of your lungs as well. So those are actually breath holding. So the breath holding exercises are very good, and they're good for many people and for many reasons. For people with asthma, for people with anxieties, stress, um, sleep disorders. So the breath hold exercises are great. They have a different variations. So, but it's always air in, always air out, and through the nose. You can hold your breath for starting from 2 seconds and extend it to longer. We have a gauge that we're using to see how well the performance of all those gases in the body is going. So it's called the control pose. The control pose is something that we are measuring how long you can hold the breath. But it's not how much like you holding the breath till you're turning blue. It's how much air you can hold, and when you release the nose, how much air you can take in without gasping. So it has to your breathing has to get back to a normal breathing as soon as you release your nose from holding the breath. Okay, so prior to that, I would recommend to do a nose clearing exercises. Those are very easy exercises, especially for somebody who has mucus in the mouth, in the nose. Okay, so we can do it together if you want to practice that.
Okay, let's do it.
You want to try it? Okay, so you take an air in through your nose, out through your nose, pinch your nose, and move your head side to side. And you're going to be holding the air till you have a first desire to breathe. As soon as you take a first desire to breathe, okay, so that's good. So usually I measure that, and that gives me a gauge how chemosensitive you are to carbon dioxide. All right, so I always measure that. So, and our goal is, my first goal is to go from whatever number I get to 20, from 20 to 25, from 25 to 30, 35, and 40. 40 is our maximum gauge. But some people get a little bit stressed about the numbers. I did have patients who were like very stressed. Oh my gosh, next time you're going to ask me to go to 60s, and I don't want to do that. And so this is gauge for me. But if somebody is getting very anxious with the numbers, I'm just using something else to see how well the process is going and progress of that. So it's a gauging for progress. With little kids, though, you are not using this. You're not using the control pose like that. So what you're doing with that, you are using steps. They take the air in, air out, and they walk without taking the air. So how much steps they can do, the more they do, the better.
Mm-hmm.
We can run with that too, but make sure that they're always breathing through the nose. I think I also wanted to tell you about the nose clearing exercise. So the nose clearing exercise and the control pose, that's what we use now. Like they're a little bit similar, but yet they're very different. So when you take an air in and air out through your nose, you pinch your nose and you start moving your head or your arms or any kind of movements that you're making. That helps you also to produce nitric oxide.
Okay.
Okay.
So
And
somehow
usually,
that head movement, what does that do?
what that helps you to produce the nitric oxide in your body. So, and that will clear the nostrils. So, but you have,
How does it do it?
oh, well, you
What's
know
the
what?
mechanism?
They don't really know exactly how it works, but it works. Okay. So this time when we're doing like a nose clearing exercises, the breath hold should be just a little bit longer. Just basically you pushing yourself just a little bit. Take an air in, air out, pinch your nose. And then you take an air in again through the nose. So first of all, we produce nitric oxide already. So we moved the air in. So we have the carbon dioxide, we have an oxygenation exchange. And you do that 5 to 6 times to clear the nose. You will feel like you will have a little bit better nasal patencies. To check the nasal patencies, you can also close one nostril and see how much air you can get in, or the other. So every 90 minutes, the exchange between nostrils it changes. So every 90 minutes time gap, you can
Mhm.
breathe through one nostril better than from another, and in another 90 minutes can change.
Let me ask you a question. So you told me to stop holding my breath as soon as I feel the desire to breathe.
Yes.
Well, this happens very soon.
Mm-hmm.
But I know I could probably, if I fight the desire to breathe, I could probably hold it much longer. And I'm kind of a competitive person, and I kind of like when I hear some recommendations like, "Oh, you just do go little by little." I always try to take it. I always like multiply it by 10.
Mm-hmm.
I don't know. For example, when I broke my foot, the doctor also gave me when I was recovering, the doctor gave me all these recommendations, this and that, and I was like, you know what? This is recommendations for everybody, but I'm sort of an athlete, so I know myself, and I just multiplied it by 10. And when I came back to the doctor was pleasantly surprised how well I was progressing. And I kind of trust that I know my body, and this is not a recommendation for everybody, but just for myself. But the question to you is that is it okay if I experiment holding my breath as long as possible? Or is there a
Well,
problem with that?
it's not a problem. It's not a problem at all. The only reason is why we're checking the first desire to breathe, because that tells us that how sensitive you to carbon dioxide. We do have a control pose and we have a maximum pose. As long as you remove the fingers from your nose and you can breathe normally after that without taking too much of the air, you're okay with that.
Mm-hmm.
It doesn't have to be like any kind of movements like that, so then it's too much.
Mm-hmm.
So you can engage also, you can the first desire and the maximum hold, and you can find the sweet spot there. So
Mm-hmm.
where can you stop doing that?
So is the goal, what is the goal of this exercise, to gradually decrease your sensitivity to
You can
carbon dioxide
sensitivity
so
to
you can
carbon
expand
dioxide.
this?
It's not an exercise, it's more of a gauge. It's telling me how the exercises that we did before, the slow breathing, the light breathing, the decrease, the breathing that helped you to sleep better or control your anxieties, how well they are working for you and how they are helping you to be less sensitive to carbon dioxide. So basically, it's just a gauge. It's not really an exercise. It's for
Mm-hmm.
me to know, like I'm checking that with my patient in the morning and at night. And why I do that? Because in the morning, when they do that, as soon as they wake up, if their control pulse is lower than it was at night, it tells me that when they were sleeping with open mouth. They were kind of
Mm-hmm.
losing a lot of carbon dioxide. During the day, when you're more mindful, so you can control the nose breathing a little bit better, you can keep the mouth closed, so your CP, which is control pulse, might be a little bit higher. So what does it tell me? It tells me that we have to work on this on the sleep breathing a little bit more.
Okay, so you mentioned that the problem would be losing the carbon. So when you breathe through your mouth, you lose carbon
Yes.
dioxide. So
Yes,
why is
a
carbon
lot.
dioxide why is carbon dioxide important? Can you go a little bit into the science of it? So you
Sure.
mentioned, I think you mentioned one thing, that it helps uh
With
taking
oxygenation.
the oxygen. So basically the hemoglobin, right? Am I saying this right? Hemoglobin in
Yeah.
our blood
Yeah.
carries the oxygen from lungs to the tissues, and carbon dioxide helps that oxygen to go from hemoglobin to the muscle. Is that
It
right?
releases the oxygen. Yeah, it triggers the oxygen release from the hemoglobin into the bloodstream, into the lungs and everything. Yes,
Okay.
it's a catalysis, in between those two. Without carbon dioxide, you won't have a proper oxygenation. Simple as
Hmm.
that.
Are there any other benefits of carbon dioxide in the blood?
In not that I know of.
Not that you know
They
of. Okay.
probably some more, but I'm working only on the breathing, and that's my thing is to find the equilibrium between oxygen and carbon dioxide. Again, too much oxygen gonna cause you to have a hyperventilation. Hyperventilation gonna cause you to be in a sympathetic response. Sympathetic response, it's all about flight or fight. So, and our goal is again bring the equilibrium between parasympathetic and sympathetic response. Sympathetic
Hmm.
response is like you, your body is in constant danger. So
Hmm.
the have too much oxygen, your brain says, oh, something is not right. So we need to prepare ourselves to run away from the danger. It was saving our ancestors from running from the tigers and from other dangers.
Hmm.
That's very important. Sympathetic is important. It's not about like bring sympathetic down and parasympathetic up. It's all about the balance. Okay.
Hmm.
And when we have carbon dioxide in our body, when we have this equilibrium, so your body knows then it's safe. In addition to that, I wanted to mention something about nitric oxide. When I told you about humming, so since we started talking about parasympathetic a little bit, so when you hum, you can feel like a little bit vibration in your throat. When you do that, it triggers the vagus nerve. The vagus nerve is the longest nerve in our body. It starts in our brain and it goes into thoracic area and to the abdomen area. So we have a branch which is oropharyngeal area right here in our throat. So when you vibrate your throat and vibrate your nose, so you're actually triggering the parasympathetic, you're triggering the vagus nerve, which is brings signal to your brain telling you, hey, we're good, we're safe. So
Okay.
that also helps you to bring the parasympathetic response more, being more engaged in your body.
Mm-hmm. Yeah, that's awesome. And I think I just love this because this is it's one of those things that I think we're just not most of the people we're not really ready for this information today. For some reason, it's just nobody tells a little kid like as when I was growing up for sure. It's like, okay, breathe more to get more oxygen. Like when you
Mm-hmm.
go, when you go to the hospital when something's wrong with you, they give you oxygen, right? So it's just like, and I don't know the details of this, but I think it's just the traditionally, culturally, or even sometimes the science is just not there. But it's just that you 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 used to this idea, certain ideas, and it's very hard for you to get used to the new ideas, which is the carbon dioxide is actually also very important. We're just so used to thinking about it as the bad guy, but you're
Mm-hmm.
saying it's the balance, and it actually uh, helps getting you the oxygen. The carbon dioxide helps
Yeah.
getting you the oxygen, which just it's just amazing because you're always thinking, okay, you breathe in oxygen, that's the good thing, and you breathe in the carbon dioxide, which is the bad guy. But no, it's much more nuanced.
Yeah, absolutely. As I was saying, too much oxygen triggers your body a sympathetic response. It tells you that you need to run, you have to be prepared to fight. Okay? And
Hmm.
when we run, like when we used to run from a danger, probably we had to open the mouth, we had to breathe through the chest, because we needed fast. Okay, so
Hmm.
now we don't have this danger. But even before this, those are our ancestors who were running away from danger. They run away, they're safe, they start breathing normally. We, at our lifestyle that we have right now in 21st century, we constantly on the go, we constantly stress, we constantly in danger. So that's why we
Hmm.
have so many issues with the panic attack, with the stresses, and cardiovascular diseases also, because like the blood pressure is high, and so many other issues. And the interesting thing is that the breath is something that we do without even thinking. Without the
Hmm.
breath, we cannot do for very long. Breath is our body always will choose breathing over anything else.
Hmm.
And I want to mention something about also we talked about kids a little bit. A lot of kids, when they cannot breathe through the nose, their diet is really poor. Why is it poor? Because they breathe, if they breathe through the mouth and the mouth is the only way to get an air, body will choose the air over the food. So what they're choosing to have a very fast, like they don't chew, they become picky eaters. So
Hmm.
picky eaters like who eat like a very soft diet, like something that goes really fast so they can breathe.
Hmm.
Yogurt, something that they don't have to chew. Because when they chew, they cannot breathe, they can choke. So
Hmm.
that's why the nose breathing is so very important
Hmm.
for for
So
for their.
real quick question about just to go more about the breath holding.
Mhm.
Is it good? Is it recommended? Does it have any benefits to try to hold your breath a little bit when training? So for
Sure.
example, high intensity. So I'm doing like some kind of high intensity training, like sprints. Okay, so I try. So again, I listen to Oxygen Advantage. This is seems to be the recommendation that you should try to, as you sprint, exhale and just try to go without breathing for some time. What is your opinion about
Yes,
that?
yes, yes, absolutely, absolutely. I want to mention then that there's the uh, four athletes at this point, like elite athletes, then who are using Buteyko breathing, so nasal breathing. So Federer, the tennis player, the other tennis player, she's from Australia, and I think from Australia, her name is Ashley Barty, and two sprinters. So one is Sanya Richards Ross, and another one is Maurice Green. So they're all using the Buteyko breathing techniques to enhance their performance. Okay, so they always breathe through the nose and they like holding their breath as well. So yes, I do recommend holding the breath. A lot of my patients are starting their training in Buteyko breathing by holding the breath and counting steps. Even though it's very good for kids, it's also good for very busy adults, because let's go later, go from point A to point B, they walk, so they can actually
Yeah.
take an air in, air out, and do a couple of steps and see how much they enhance that's how many steps they can do next time, next morning, next evening, so that definitely helps them to this is all about carbon dioxide. Okay, so we're holding the breath, we're just training our brain that that much carbon dioxide in our body is okay, so we don't
Mhm.
have to get into panic. I need to breathe.
Okay, so and again, practical. I know we are kind of being repetitive, but I think I noticed that a lot of times I try to go forward too fast, and I kind of leave people behind because people need time to absorb the information, and sometimes we need to repeat this. So let me ask you. So let's say I'm just a normal person. Maybe I'm an athlete, or maybe I'm just a normal person that want to try this, and I want to try breath holding while counting steps. It's a simple thing, but already there's different ways I can do it. I could hold on inhale, I could hold on exhale, or I think I heard something like boxed breathing, where you hold for 2 steps on exhale, then you inhale for 2 steps, and maybe you hold for 2 steps on the inhale, etc., etc.
Yeah.
Can you give your recommendation which one is the best from both health and practical point of view? Pros
Sure.
and cons. Uh,
Sure, absolutely. So the box exercise and the holding the breath on inhale is a little bit different. The box exercise is like a helps with anxiety a lot. So this is basically to bring the awareness to your breathing. So that's where the box exercise, the one that you were talking about, like a in for 2, hold for 2, exhale for 2, and hold for 2. That's why it's box, right? Just like
mhm,
that. So when you holding exercise like that, it's just about you bringing the awareness to your breathing and controlling your breathing a little bit better. Slow it down. Okay, so when you're like the breathing everywhere, so you're kind of bringing your mind into the box. My
mhm,
favorite exercise is the inhale, exhale. I would call it triangle. Inhale, exhale, hold. You always have to observe a natural pause at the end, because we're not breathing like in and out, in and out, in and out. We are breathing in and out, and it has a natural pause at the end. We can extend the pause a little bit, the holding on the exhale, just a little bit. And it is repetitive. It's all about carbon dioxide. So because we are harvesting carbon dioxide, we're keeping it in. Okay, and that's why we like to hold it on the exhale. When you're holding on the inhale, that's another story, because when you inhale, you take too much oxygen. That can trigger the sympathetic response. That can
mhm.
cause the anxiety, instead of bringing the parasympathetic response into play. Okay, so
Okay.
that's why the holding the breath on the inhale is not as recommended, and the holding the breath on the exhale. Make sense?
Yes, awesome. And I think this is so useful because this is not news for me, although it's not news for me, but I needed this confirmation from you because again, I'm just hearing stuff here and there and trying to piece it together, and for some reason, it's not just not part of the mainstream. And by the way, let's just use a couple of minutes to talk about this. Why is it not? Why is this all this stuff not part of the mainstream? Why is Buteyko not part of the mainstream? Why is it so? He's very like I don't think what percent, like 0.5% of the people probably heard. Like
Yeah.
very few people. Maybe if you're from Russia, maybe you have it. Maybe you hear,
You knew about
even
that
if you're
before, yeah.
Russian speaking, you don't hear that much about this person unless you did the research. Why is it so? Do you
You know
think?
what? My guess is because the pharmaceutical companies are making a pill for everything nowadays. That's my guess. Like, so
Hmm.
you're unhappy, here's the pill. You're hungry, here's the pill. You're like have a lack of appetite, here's another pill for you. So I think that's one of the reasons also. I'm not saying that pharmaceuticals are bad. They're not bad. They're like
They
really
are
needed
bad.
for some for
No, I'm
some,
just kidding.
but but on the same point, like, so a lot of things that we can control with the food, as you know, with the regular exercises and with the breathing, healthy lifestyle, no smoking, no drinking, and everything else, all the other recommendations that to have a healthy life.
Mm-hmm.
It's hard for me to say because I think also because it's a lot of time needed to exercise that the results are not as fast than
Mm-hmm.
to sleep. So I think that's another reason that we want to have everything fast. We want it now. Like,
Yeah.
I did this breath hold exercise. Why is it not helping me? Like you try to do that too. Like you're overachiever. You want everything to be done like quickly, but it requires time. Everything
Mm-hmm.
requires time, repetition, and you, as I said, sometimes we have to exercise 15 to 16 times a day, 5 minutes, but it still requires time to do that. So I
Mm-hmm.
think that those are the reasons that I see.
Yeah.
And I think now in mainstream, like it's more of a holistic. I don't want to overuse the holistic, but the natural way, holistic way, are like people are more into clean eating and clean living. So I think it's coming around a little bit more and more. People are more interested.
Mm-hmm.
So the demand in that is much higher nowadays. That's what I noticed.
Yeah. And by the way, so your practice is called holistic. Uh,
Yes.
has a word holistic in it. So, is my understanding correct? You're focusing on the breath, but actually it's about more than just the breath, right? It's because the holistic involves everything, right? So can you talk a little bit more about your practice specifically? What you just focus on the breath, or you focus on everything?
No, I'm focusing. It's an airway focused myofunctional therapy. So
Mm-hmm.
myofunctional therapy is the therapy for the muscles of the oral cavity. I'm working with the tongue position, making sure that the tongue is in the roof of the mouth. That's very important. And because when you have a tongue on the roof of the mouth and mouth is closed, you always will be breathing through the nose also. So I'm working with the therapy that I do is very long. It's
Mm-hmm.
like 9 months to 12 months long, and this like involves all kind of different exercises for the oral cavity, for the tongue, for different parts of the tongue, for the cheeks, for lips, and for everything else.
Mm-hmm.
Because I'm also working with the palate, making sure that the palate is wide, because sometimes when kids were not breastfed, so the palate is very narrow, and when palate is very narrow, so the tongue doesn't have enough room on the palate. And this is a different conversation for a very long conversation. But
Yeah.
yes, I'm working with the oral cavity muscles to make sure that we have a proper function: sleeping, breathing, eating, speaking. So this is basically my focus. My
Do
focus is
you
the air.
do you do
Yeah.
online as well, or only in person?
Yeah, I actually, majority of my practice is on Zoom, but
Okay.
at the first time when I see my patient, I'd like to see them in person because I want to check everything. I want to take a lot of pictures. I want to touch everything, make sure that everything is working properly. I want to take photos and videos, and so by the end of the therapy we can compare the differences. So that's very important. So the first visit is always in the office, and it usually takes like 2 hours for a whole evaluation because I'm asking for a birth history, the breathing history, the feeding history when child was born, and when child started walking, and if they crawled, when did they start speaking, even if it's not the child, if it's an adult. So I would like to collect all this information and have it.
Mm-hmm.
So,
Do
what
you
kind of
take insurance? You
no,
take insurance?
no
No?
insurance doesn't cover the
See
insurance.
that?
Unfortunately, doesn't cover any of the um, practices what I do. So sometimes they would HSA would allow to pay for
Hmm.
that, but that's about it. Yeah,
Yeah, see, that's part of the problem, right? This is part of the problem
absolutely.
with our society a little bit, right? Because the insurance will cover uh, the drugs, right? The
Mm-hmm.
insurance will cover the surgery. But as soon as you say, but if you say, listen, I'm going to treat you with with the food,
Mm-hmm.
I'm gonna tell you the food to eat that's going to cure you. Number one, insurance is not going to cover it. Number two, many people are going to dismiss you right away because they're going to say, oh, this is not science. Well, but if you're dismissing somebody right away without giving it a chance of a doubt, how good of a scientist are you? This is my question.
That's
Because
true.
this it goes, I consider myself a scientist, and
Mm-hmm.
I used to be a little bit arrogant too, and I used to say, oh, no, 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 this is not science. This is just, when I hear the word holistic, I'm like, I don't know what you're talking about. But then I said, I was trying to be honest with myself, and I said, why am I just dismissing this? If I'm a scientist, I have to think about it. I have to do the research. And when I did, I realized that how wrong I was about this.
So, because holistic, the word holistic has a little bit of a negative note in it, but the holistic means it's whole. It's
Right.
whole. So you treat the person as whole, like including everything, the lifestyle, the food choices, everything what they did or will do in the future, and what their goals in life are. So
Yes.
everything, it's all together and it's combined together. That's why it's called holistic. Well, but that's how I treat it, the
I
whole.
think I think if not now, in the very near future, this is going to be rediscovered, because we're realizing that I was talking to a very smart guy, scientist, and he said, the science is great, but the problem with science is it's reductionist.
Mm-hmm.
We're, as scientists, and it's not a criticism, it's just how science is done. We always
Mm-hmm.
try to reduce the variables,
Mm-hmm.
because we cannot just throw everything into the soup. How can we study this? We always say, well, we're going to change A, and we're going to see how that influences B. In order for me to do that, I have to eliminate all the other letters of the alphabet. It has to be A and B. But the problem is that our body is such a complicated system, where everything you cannot eliminate. Once you eliminate all the other letters, now it's completely different. So if you try to study the effect of certain food, well, the effect of that food is not the same without some other food. So
Agree,
it's very hard to
100%.
study. So if we sort of come back, we go to the science, but then we come back to, well, how about our intuition? And how about artificial intelligence, which is a kind of the neural network, it's not really A to B. It's just taking all the information and then coming out with some kind of solution. We don't necessarily know how.
That's
So,
right. And like I like that you brought this point of the reductionist, like we do have to see what works for us, what doesn't work for us. Everybody is very different also. So you have to know what works for me may not work for you also.
right,
You cannot say that this blueprint fit all. It doesn't. So you have to make sure then you find what's good for you, what helps you to become healthier.
right,
So that's very important. Like, so that's why when you say, well, everybody can do this, the breathing holds, yes, everybody can do it. But some will see the result and some would say like it's a snake oil, so I don't need to use that. So it's also mindset.
yes,
Achieve
that's
with
another
that.
whole area, mindset.
What else you want to achieve? I actually want to show you a couple of books. I prepared a couple of books if you would be interested. So this is also by Patrick McKeown. So this is the book that he's an oxygen advantage specialist. So he wrote few books. I have this book. I have that book. This is his latest book. It's called Breathing Cure. I don't know if you see it or not. So that's also written by him. He is actually coming up with a new breathing for yoga and meditation. And another book that you can maybe be interested in is by Nestor. So it's all
Hmm.
about the breathing. So I think you will find this book very interesting.
Thank you very much. I'll definitely check it out.
Yeah, if you need that detailed information, I will definitely can email that to you so you can see that. Okay.
All right, Julia, thank you very much. I've kept you a very long time. I
My
hope
pleasure.
to.
I hope I answer all the question. I know I have so much to share, and I feel like I could talk more, and like I just don't want to take too
Well,
much
I would
time.
actually, I would actually keep you here for another hour, but
Sure.
I don't know if you can hear it. There are some landscapers that decided to come right at this
Oh,
moment, right outside where I'm sitting, and
that's
I
what it
can
is.
barely hear you. But that's also probably a good thing because you probably have other stuff to do. But I also hope we're gonna do this. We can do this again because
Sure. I,
there's so
like,
much
thank you
to talk
so
about.
much. I enjoy talking to you. And as I was saying, you have like really an amazing intuition about your body. And I love, love, love your interest in the way how breathing affecting the whole life experience, like, so how we can definitely can talk about different things. And I can teach you next time how to control anxieties.
Okay, I need that.
We're gonna do those exercises together. So next time it's gonna be more practical. I promise.
Okay, okay, cool. Thank you, Julia.
All right, it's my pleasure. Thank you so much, and I'll talk to you soon then. All right?
Okay, bye.
Yeah.
Пока.
Bye.